It's interview season right now, and a lot of people watching this video are either waiting for interviews or have received interviews from their medical schools and aren't really sure how to prepare. Medical interviews can be really all over the place, but there are definitely a few questions that seem to commonly come up and are a bit more popular amongst interviewers. Hey guys, welcome back to the channel. If you're new here, my name is Jack Ray and I'm a first year medical student studying at UCL. And in this video, I'm just going to give some general tips about some questions that I feel are really common in medical interviews. And I'll also be giving you some model answers on how I would answer them, or how I did answer some of them when I was applying for medical school. I remember when I was applying, there weren't that many videos that showed actual model answers, and I feel like it's time to change that. Now, I wouldn't recommend you copy any of these model answers, but it's more so just to give you an idea of how to implement some of the advice I give in this video. As usual, timestamps will be in the description below, so you can jump around and find whatever you're looking for without wasting any time, as well as timestamps to the model answers if they're the only things you want to watch. Now, the first type of question I want to talk about is the why medicine and not nursing, or why medicine and not X, Y, and Z. They'll usually either ask you specifically why you want to do medicine, or they'll ask you why you want to do medicine rather than another healthcare specialty, for example. Now, the most important thing with these questions is you do not want to disrespect in any way, either intentionally or unintentionally, the other specialty that they mention. You have to remember that a lot of the times your interview panel might not even consist of doctors. You might even have a nurse in your interview panel, and if the question is why not nursing and you start kind of disrespecting nurses, then obviously that's not going to look very good. So step one with these questions is always to acknowledge the other specialty. If they, for example, mention nursing, then acknowledge the contribution they have to the healthcare system, praise them, mention the fact that they're important in making sure everything runs smoothly. That's usually the best way to start off your answer, and it lets you avoid being disrespectful in any way. Next, you have to think about what makes medicine unique. You can mention some of the things such as helping people or making an impact on other people's lives, but the whole point of this question is that they're trying to make the point that these things are common in all specialties of medicine. Whether you're a nurse or a doctor, you will interact with patients, you will be helping change people's lives for the better. So you need to start thinking about some of the things that are a bit more niche to medicine and being a doctor. Now, some things you can consider include the scientific element of medicine. Doctors definitely study the human body on a deeper, more scientific level than, for example, a nurse. You can also talk about maybe the more leadership role that doctors have to take. A lot of the times, doctors are the ones who make the final decision about a patient's treatment plan. And if you can kind of word that in a nice way to talk about maybe why having a leadership role intrigues you, then that will also look really good. And if you want to look further, you can maybe talk about some of the prospects of being a doctor, such as potential research opportunities. Like I said, because doctors kind of have to have a deeper understanding of the science and the anatomy of the body, it kind of opened the door for more research opportunities. There are definitely more things you can talk about, but those are just the main things that I think come to mind when I think about what makes being a doctor different to being a nurse. And overall, if you can put all of that together, if you can acknowledge the importance of the other specialty or the other role, if you can highlight the things that make medicine unique, and just make sure to link it back to yourself. So for example, the fact that medicine and being a doctor involves a more scientific kind of view of the human body. Why does that intrigue you? Are you interested in science? Is science something that's always kind of been something that's fascinated you? You know, bring out your own personality and try not to be generic. Now for the model answer. Firstly, I think it's important to acknowledge the importance of nurses. I feel like their role is integral, and without them, the whole healthcare system wouldn't be able to function as efficiently as it can, and it would be a huge compromise to patient care. However, I feel like there are certain elements of the role of a doctor that differ from what a nurse may have to do, and it's these differences, along with many similarities between the role, that ultimately make me want to be a doctor. Now, of course, things such as patient interaction and actually taking care of patients is quite similar between the two roles, and although that is something that is really interesting to me, there are other elements such as the integration of science within being a doctor that are really interesting to me. I feel like doctors have to understand more so the biology of the human body and the science behind it, and this is something that I've always been pretty interested in, and I feel like is a large reason why I want to be a doctor. I also feel like they have a more of a leadership role and have to make more difficult decisions in terms of patient care. And although this does seem daunting, it feels like something that aligns with some of my skills, and I feel like it's something that I'd be good at. Along with this, the more hands-on nature of being a doctor, especially when considering roles such as surgeons, is something that appeals to me quite significantly. I feel like I want to be able to kind of see the human body at a more closer level, and understand the biochemistry of it in a deeper way. And this is something I feel I'll only be able to achieve if I go through medicine and become a doctor. There's also other elements such as research. I feel like as a doctor, like I mentioned, because you have such a deeper understanding of the sciences, it opens up the doors to other opportunities such as potential research papers you can write, based on some of your interests. And I feel like this is something that, although I might not consider as much at the start of my career as a doctor, is definitely a door I want to keep open, as research is something that does interest me. Overall, I'd say that although nurses have a very crucial role and there are many elements of being a nurse that appeal to me, primarily, like I mentioned, the whole patient interaction and being able to still make an impact on patients' life, the scientific element of being a doctor and kind of the extra deeper understanding of biology is what's attracted me to the role of a doctor and ultimately to applying to medicine. The next type of question I want to highlight is the question of, why do you want to study at our university? Now, like I mentioned, I'm a first year at UCL, so I'm going to be using UCL as an example for my model answer, but the advice I give will be generic to any university you're looking at. There are a lot of things you can mention in this question, and the go-to thing is just to mention kind of the academic element, but you're allowed to look at it in the bigger picture. So think about the location of the university. Is the location something that entices you? And if it doesn't, maybe think about why the location might be a reason people want to come there and talk about that. You can also, and it's recommended, to talk about any prior experiences you've had with the university. Now, I know a lot of medical schools, including UCL, run certain workshops for aspiring medical students where they kind of bring them in and teach them something. And if you've been lucky enough to be part of some of these workshops, then bring it up in your interview. Talk about how that might have influenced your decision. And it's really a good way to talk about how you've kind of had the opportunity to experience the student base, the type of people who attend, and kind of the atmosphere of the university. That can definitely make it sound like your answer is a lot more thought out than people who might not have been able to utilize these opportunities. Lastly, it's also worth, mentioning their teaching style. You don't want it to be the only thing you talk about, because a lot of people will probably have looked at the uni website and searched up things about the uni, but you can talk about it. If the course structure or a certain element of the course appeals to you, then it's worth mentioning. You can also kind of talk about the facilities, and you can be unique about this. You can also link it back to the location. For example, with me studying in London, one thing that I think really makes studying in London unique to maybe studying elsewhere is just the amount of hospitals there are. There are so many hospitals with some of the top facilities in the world, and having such a high concentration of hospitals in one place means that there are so many facilities that your medical school can potentially make you kind of utilize, and that's something I talked about. Make sure at the very least you link it back to you personally. So for example, the thing I mentioned about the location and the hospitals, maybe if you're someone who's really interested in the clinical element of medicine, you can mention how during your clinical years you feel like this is really going to play a big role, and clinical skills is something you're very interested in, and you feel like you want to go to a uni that will provide you the best facilities, just as an example. Avoid giving generic points like person X has gone here, or you have this certain lecturer that teaches here, because that's just going to sound really robotic, and for the most part it's going to sound like you've just opened up their website and kind of just searched up the faculty and picked someone to talk about. So try and avoid that if you can, because realistically at university you're going to have so many lecturers, and a lot of them you're not going to see that often, so it doesn't really make sense for you to commit 5 to 6 years for a single person. And now for the example. Now, there are many reasons why I applied to UCL and why I want to study medicine there. Firstly, I feel like UCL is a very prestigious university. They have a very high rank amongst other medical schools, and I feel like this is definitely something that caught my attention and made me want to apply there. On top of this, I've had many opportunities to be part of programs held by UCL. The most recent being Target Medicine, which was a whole scheme put in place to help students like me from underprivileged backgrounds get a better understanding of what medical school entails. And part of this opportunity allowed me to have a medical student as a mentor, and talking to her allowed me to kind of get an understanding of what the medical school is like, some of its key principles, and just overall what the experience there is like. And I found that talking to these medical students made me just want to come to this university a lot more. On top of that, I've got to experience the diversity within UCL. There are many people from many different backgrounds, and I feel like this is something that's really important to me, as I think that university is a good opportunity to meet new people and kind of indulge in other cultures. On top of that, the fact that it's based in London is also a huge benefit. London is one of the busiest cities in the world, but along with this, it has some of the most top end hospitals in the country, and I feel like these facilities will only enhance my teaching and allow me to experience things that I may not have been able to do if I attended another medical school. The plethora of opportunities within London is also something that attracts me, and just the overall beauty of the city is something that makes me feel like I would enjoy my time at UCL. Overall, I feel like the teaching standard will be top class, which is reflected by the university ranking, and just the overall location is something that attracts me, as well as the student body and the people that come here. Next question that I feel like is a really common one, and it can really stress people out, is what is something you've read about recently around medicine that has interested you? It might not be worded like that, but they might ask a general question relating to some further reading you've done. And this catches a lot of students out because, one, a lot of students don't do further reading, which is a big mistake in my opinion. You should at least kind of read up on something. And number two, just the pressure of the interview can mean that people kind of forget what they've read, which can happen. Now, this can be a book or a research article. Don't think that you have to talk about a book when they say what's something you've read. I know for my UCL interview, when I had a question similar to that, I primarily talked about a research paper I read, but I was also able to, if I needed to, talk about a book. So it's good to have like a variety. If they use words like recently, don't panic. Don't think that if you've read an article or a book like a month or two ago that you can't talk about it. For the most part, they won't know. And if you just say in the interview that, oh, something I've read recently is, and you mention it, then they'll be none the wiser. And to them, they will think that you've genuinely just read that. But just be careful if it's something that you've mentioned in your personal statement, because obviously you submitted those a few months ago. So they'll know that that's not something you've read recently. So definitely keep that in mind. I think a good approach for these questions is just to summarize some of the key elements of the book. And if it's a research paper, then summarize the findings. That's very important, because kind of the biggest element of a research paper is what has been found out from it. So you don't want to miss that out. It's also worth mentioning some of the things it taught you. So for research papers, it's a really good thing to think about some of the implications of the research. So what I mean by that is, what might this research lead us on to develop, or what might we kind of learn from this research that will help us advance medicine. On top of that, it's worth mentioning if maybe the research findings shocked you, maybe it wasn't something you've expected, because by mentioning things like that, you're showing a really strong level of reflection, which the universities love. If it's a book, then instead maybe talk about how it's changed your perception of medicine, what you've learned about it. A lot of books will teach you things about the work-life balance of being a doctor, of the general stress of being a doctor, and just overall some of the important qualities of a doctor. So a lot of books might talk about things or allude to things like empathy or teamwork and whatnot, and it's good to kind of pick up on that and talk about it in the interview. Now for this question, being specific is actually a very good thing. Avoid being too generic. For example, if you're talking about the findings, if you can, try and kind of use some specific numbers, or if you're talking about a book, specifically talk about like a certain point, because you don't want it to seem like you haven't paid attention or that you're just kind of making up on the spot. which is another thing you shouldn't do. Please do not make up any further reading. You might get away with it, but more often than not, your interviewers might act or will probably catch you out. And obviously, here's the example answer. A book I've read recently that I feel has had a huge impact on me is by Paul Kalanithi, and it's called When Breath Becomes Air. I feel like this book was really interesting because it took a unique perspective when compared to some of the other books I've read related to medicine. Unlike the other books, which would solely take on the approach and perspective of a doctor, Paul Kalanithi takes a more unique approach in that he talks about his experience as a doctor as well as a patient, which I thought was a really interesting dynamic. The whole book is kind of documenting his journey through medical school, as well as how he felt after he was diagnosed with stage 4 metastatic lung cancer. Although the story is really sad and there are points where it gets very emotional, I feel like it shows very clearly some of the challenges that doctors face. At many points in the book, even before his diagnosis, he talks about the challenges of balancing his family life as well as his relationships alongside his passion for medicine and kind of the dilemmas he faces when making decisions. I feel like this is really reflective of what a typical doctor will go through in their life, whereby they will have to make difficult decisions with consideration to both their own personal life as well as their goals in the bigger picture. The book was definitely really touching, and it kind of showed me how it can be like to not only be a doctor but also to be at a vulnerable stage as a patient, and it kind of allowed me to understand this whole idea of empathizing with patients so much more. As a doctor, he describes how some points he felt like he had no control and how he kind of just felt overall quite helpless. And I feel like this is a good reflection of how patients might feel sometimes. And it's very important to kind of take that into consideration when treating them. So I say this book definitely was very touching and also helped me understand some of the deeper concepts and qualities of being a doctor, as well as some of the challenges that doctors will face in their day-to-day life that might not be as common in other specialties or vocations. Next question, another common one. What is something that you have seen in your work experience opportunities that has interested you? Now, again, don't panic. There are so many things you can talk about. If you haven't had the opportunity, for example, to shadow specifically in a hospital, then talk about things like volunteering or other extracurricular you've done related to healthcare. I know for me, in some of my interviews, they asked me about work experience, and because of the pandemic, I didn't have much. So what I did was I kind of talked about the little work experience I did have and then slowly linked it back to maybe some further reading. It kind of went something along the lines of, this is the work experience I did. It was very brief, but this is what I learned. And moving away from that, I was able to reconsolidate this learning by reading X, Y, and Z. For example, for these type of questions, when you're practicing, it's really useful to use the STAR technique. So the situation, for example, where were you? The task, what you had to do, the action, what you actually did, and most importantly, the reflection. So what you gained from it, what you learned from that experience. Now, as you do more and more practice, what I typically tell people is you slowly move away from using a very strict STAR template. But as you're starting off, it's a good way to kind of avoid you coming back on yourself or repeating things you've already said. And as you get more practice, you'll find that you'll naturally or more intuitively be able to answer these questions. And you might end up kind of moving all these like parts around. So you might talk about the reflection and then give more details about specifically what you did. It's up to you. And it's all about how you say it with confidence, and you develop that confidence through practice. Just make sure you do prioritize reflection. A lot of admissions tutors will tell you that it does not matter what experience you had, as long as you've shown that you've gained something from it, because that's showing the interviewers that you're proactive, and that's very important to them. Now, here's the example of how I would answer this question. Despite the pandemic, I was very fortunate enough to have some sort of work experience opportunity, and my work experience opportunity involves shadowing a surgical theatre assistant as he prepared the instruments required for a cervical decompression procedure. During the whole experience, I was able to ask questions about his role and got to learn of the integral nature of it and how failing to complete his role would mean that the surgeon would be unable to operate the following day. This not only showed me the importance of his role, but allowed me to more clearly visualize the whole multidisciplinary team aspect of medicine, showing me how there is not a single most important element of the whole team, but it is the importance of everyone and ensuring that everyone completes their role that ultimately allows good patient care to be delivered. On top of this, I got to see the surgical theatre assistant interact with the surgeons, and despite the fact that I initially thought that surgeons were the most important, or more so that doctors were the most important element of a hospital, I saw the level of respect the surgeon was showing to the surgical theatre assistant, and I got this overall sense of camaraderie that I'd never got to experience before in a hospital. It kind of just showed me the importance of a positive work environment and how crucial it is that everyone gets along and is able to collaborate and be comfortable with each other. I feel like this comfort is essentially what allows all members of staff to complete their role, and also allows them to manage well in what is otherwise a very stressful environment. I feel like this was also very unique as it wasn't directly linked to the medical nature of what I was seeing, but it was more so kind of the human aspect of medicine, seeing people interact, being friendly with each other, and overall just promoting a good atmosphere, which I thought was very important in a healthcare environment. And being able to experience it firsthand definitely showed me the importance of promoting this sort of work environment in order to not only ensure patient care is met, but also to ensure that staff are satisfied and thus able to work at the best of their ability. The next question I want to talk about is something along the lines of, for example, is teamwork more important than leadership? Or any sort of question along that line where they'll compare two qualities that are important in medicine and ask you which you think is most important. They can also ask you, for example, what is the most important quality of being a doctor? These aren't trick questions, but there's more to it than what might seem. The wrong approach to these questions is to definitively say that one characteristic is more important than the other, or to definitively say that there is a single most important quality of being a doctor. Firstly, that's just not true. There are so many elements of being a doctor. And secondly, this is more so them seeing your kind of ability to formulate a structured argument, or to show them that you've kind of are able to consider all elements of a certain situation. So for example, if you think about leadership and teamwork, they're both very important. So what I typically recommend students do is when you're approaching these questions, acknowledge that. Acknowledge the fact that it's a difficult question because there are either multiple elements of being a doctor that are important, or both the elements they've mentioned are equally as important. And then what I'd recommend, just to beef up your answer a bit, is to expand on that. So for leadership and teamwork, maybe spend a minute talking about why leadership is important, and then spend a minute talking about why teamwork is important, and then kind of conclude. So then end it off by saying, so as you can see, both are clearly very important. However, if I had to pick one, then I would pick X, Y, and Z and explain. It's all about showing them that you've considered all elements of the question and that you're acknowledging that they're both equally as important. It's very similar to the first question about why medicine and not nursing. You're not saying one is more important than the other, but you're acknowledging that there is a difference between the two, and you're using that difference to formulate your argument. So definitely a really common question, and they're quite nice because I feel like this is the question most medical students are prepared for, but it's still worth thinking about. Now here's the example answer. I think the difficulty of this question comes from the fact that both leadership and teamwork are very important qualities of a doctor. I feel like without one or the other, a doctor won't be able to perform their task properly and ensure adequate patient satisfaction and care is met. Teamwork is obviously important as a large part of being a doctor is working in a multidisciplinary team. You won't know everything about the patient, and it's important that you're able to communicate with other doctors who are part of the patient's care in order to kind of reach a conclusion and have a course of action that you can take in order to treat the patient. I feel like without good teamwork, there won't be any good communication, and a lot of things will be lost in translation, and in severe cases, this can really affect patient care. Teamwork can involve communicating with other doctors as well as other members of staff such as radiologists, nurses, or anyone working in the hospital that has a role in patient care. On the other hand, I can also imagine leadership being very crucial. Without a good leader, there won't be as much coherency in the treatment plan, and it's very important that there is someone to overlook everything and ensure that everything is running smoothly. I also feel like qualities such as leadership come into play, especially in certain scenarios, such as when you're in an operation theatre and there is a very difficult procedure going on. In those instances, it could be that rather than ensuring that everyone is working well in a team, it is also equally as important, if not more important, to ensure that there is a specialist in the room who has more knowledge than everyone else and who is able to overlook everything and instruct people on what to do. I feel like, especially in cases where there is a difficult procedure going on, you definitely want a good leader in the room. So overall, I'd say both qualities are important. However, if I had to pick one, I would say that teamwork is more crucial, as there are more instances where I imagine teamwork can be the difference between ensuring a patient is satisfied and kind of not being able to deliver good patient care. With teamwork, I feel like because many doctors and healthcare staff are very competent and independent, they are able to make the right decisions, and so it's important they communicate these decisions so that everyone else in the team is aware of what's going on and so that fewer mistakes are made. Now, the last two types of questions I'm not going to give examples of because they're so broad. There's so many different ways they can ask these types of questions, but I will kind of tell you how to approach them. Now, the first of these two is graph style questions, where they'll show you a graph, more often than not one that you've never seen before, and they'll ask you to explain these. Now, step one is to slow down with these questions. Like I said, they know you probably haven't seen them before, so you're expected, or they anticipate, that you will take more time to think. While you're thinking, make sure not to panic. Don't let your mind wander. Actually focus on what you've been shown. Now, more often than not, it will be a graph. And when they do give you a graph or a table, step one is to focus on any headers that you see. So if you see kind of an overall title of the graph, that might give you a lot of information. Step two is to look at the axes. A lot of the time students panic and they completely do not even read what the axes represent. They just look at kind of the shape of the graph, and that causes them to panic. So make sure you acknowledge the axes, and this is quite important in your answer as well. It's always a good structure to start off by saying, well, this is the title of the graph and I assume this means that it's referring to X, Y, and Z, and then start talking about, well, we can see that, you know, the X-axis is showing this, the Y-axis is showing that, and this is kind of to show them your thought process. It lets them see how you're thinking, because that's what they're looking for. They're not looking for you to understand the table. They're looking to see how you might go about it. The next thing you want to maybe talk about is the actual contents of the graph or the table. So look at the shape of the lines and think about what they mean based on the axes that you've seen. It's definitely good to practice with a lot of graphs you haven't seen before. That way you can kind of develop that skill of looking at something that is unknown to you and kind of formulating a systematic way to make sense of it, which is, as you can imagine, quite often what you'll see in medical school. A lot of the times as well with these questions, your interviewer will actually help you. So it's good to think out loud. Obviously have a structure, but don't think that you shouldn't say something because it might come across a bit silly. It's better to say it because more often than not, if you're kind of on the right track, your interviewer might push you in the right direction and see how you respond to that. Now, the last type of question is the standard ethics questions. Now, the one I just for some reason remember so much is the typical scenario of a Jehovah's Witness refusing a blood transfusion, which in a lot of cases is very crucial for surgery. With these ethic questions, a lot of them will be very controversial, and because they're controversial, they won't have a black and white answer. So again, acknowledge that. Acknowledge the difficulties of the situation, especially in ethics questions. Mention why the situation is difficult. Why do you want to do that? Well, it shows the interviewers that you're proactive. It shows them that you've thought about it properly and that you're acknowledging that it's not an easy decision to make. The next thing to do is to definitely link it back to the medical ethics or the pillars of medical ethics. This is something that a lot of students will do, arguably, but it is something that they're expecting and looking out for. Now, typically, one of the key things in these scenarios is more often than not autonomy. A lot of these ethical scenarios involve patients making decisions that you might not agree with, and you having to respect that autonomy whilst also balancing the patient's needs and interests. So it's definitely, a lot of the times, think about the 4 pillars of medical ethics and try to link one part of the scenario to at least one medical pillar to show them that you are thinking about it on a deeper level. Obviously, you'll naturally be thinking about the pillars, but you have to remember, what you don't mention, your interviewers don't know. So if you don't mention the 4 pillars, they will just assume that you might not really know what they are. So tell them the details that you're thinking and try not to hold back on these questions. They want to see your unique way of thinking. They want to see how you would approach it if you were an actual doctor. So don't shy away or think that because it's a controversial topic or because it's about ethics that you have to kind of say the right answer. If there's a scenario and you disagree with the patient, you can tell that to the interviewer. You can say that although I disagree with the patient, I have to respect their decision and then think about how to move forward with that. So these questions, again, just down to practice, so make sure you do enough of these style of questions. And that's about it. I really hope that helped. There are obviously a lot more other questions that potentially can be asked, and who knows, maybe if this video does well and enough people ask, I might do a part 2 where I mention some more kind of generic questions that come up. So if there's a question that you feel like comes up often that I haven't maybe talked through, then mention in the comments below and I'll try my best to see what I can do. Obviously, like, comment, subscribe. It greatly helps the channel and I really appreciate, when I see all your nice comments and the questions you ask. And yeah, just feel free to ask questions. Obviously, I'm a medical student. It was only last year that I was doing my interview prep at this time, and it's crazy to look back and think about that. But that does mean that not only have I done it recently, but I've experienced the whole kind of stress and situation of it. So don't be afraid to ask me any question you want. That's been all from me, and goodbye.